Thank you, Mr. President. I rise to talk about my bill. In our body, we have been consistently working to address maternal mortality rates here in the state. New York is number 22 in the country for the highest maternal mortality rates. And when you break that down even further by race and ethnicity, and most certainly my community that's more rural, but also has high populations of folks of color, these numbers are even more disparaging, that women of color, and particularly Black women in New York, are 6 times more likely to die while giving childbirth, and yet more than 70% of those deaths are preventable. What this legislation does is that it will require the Department of Health to thoroughly evaluate and make recommendations on best birthing practices. This legislation is pushing for us to continue to take a more proactive approach to ensure that every mother birthing person has access to safe, high quality, and evidence-based care, no matter their race, income level, or zip code. As the chair of our Women's Issues Committee, this legislation is not just simply about improving policies, it is about saving lives and having a more equitable impact on families across our state. It is about making sure that no mother is ignored, that no complication is dismissed, and that no family suffers a preventable tragedy. I vote aye, and I encourage my colleagues to do the same, and I also would like to thank our Senate Majority Leader for supporting this legislation as well. Thank you, Mr. President.